Welcome to Nclex Practice Questions, Answers and Rationale in All Categories, Volume 5. Question 1. A 29-year-old female client, who is a professional dancer, presents to the emergency department after a performance complaining of severe lower abdominal pain, fever, and an unusual vaginal discharge. She mentions that she had similar symptoms 2 months ago and was treated in an urgent care clinic. She also reports having multiple sexual partners in the past year and inconsistent condom use. Given the clinical presentation and her history, which of the following infections is most frequently associated with a recurrence of pelvic inflammatory disease, PID? A. Trichomoniasis. B. Chlamydia. C. Staphylococcus. D. Streptococcus. E. Gonorrhea. F. Escherichia coli. Correct answer, B. Chlamydia. Pelvic inflammatory disease, PID, is an infection of the female reproductive organs. It's usually caused by a sexually transmitted infection. Chlamydia and gonorrhea are the most common causes of PID. Among these options, chlamydia is the most frequently associated with PID. It's essential to diagnose and treat chlamydia promptly, as it can lead to serious complications if left untreated, including infertility. Question 2. An experienced registered nurse, specialized in spinal rehabilitation, is floated to the busy emergency department for a shift. The emergency department is currently short-staffed, and there's a power outage in the adjacent building, causing a surge of patients. Among the patients waiting, which client should the charge nurse most appropriately assign to this RN, keeping in mind her expertise and the current situation? A. A middle-aged client who says, "I took too many diet pills, and my heart feels like it is racing out of my chest." B. A young adult who says, "I hear songs from heaven. I need money for beer. I quit drinking 2 days ago for my family. Why are my arms and legs jerking?" C. An adolescent who has been on pain medications, terminal cancer, with an initial assessment finding pupils and a relaxed respiratory rate of 11. D. An elderly client who reports having taken a large crack hit 10 minutes prior to walking into the emergency room. E. A pregnant woman in her 3rd trimester complaining of sudden sharp pain in her lower abdomen. Correct answer, C. An adolescent who has been on pain medications, terminal cancer, with an initial assessment finding pupils and a relaxed respiratory rate of 10. Nurses who are floated to other units should be assigned to a client who has minimal anticipated immediate complications of their problem. This client exhibits opioid toxicity with the pinpoint pupils and has the least risk of complications to occur in the near future. Question 3. Ward following an angioplasty for coronary artery disease. Nutrition education is a part of his discharge planning. What dietary advice should the nurse prioritize? A. Eating 3 balanced meals a day. B. Adding complex carbohydrates. C. Avoiding very heavy meals. D. Limiting sodium to 7 grams per day. Correct answer, C. Avoiding very heavy meals. Eating large, heavy meals can pull blood away from the heart for digestion and is dangerous for the client with coronary artery disease. Too much plaque may accumulate in the arteries and block the delivery of blood and oxygen in major organs of the body. Option A. Eating a balanced diet should be a part of the management of a client with coronary artery disease. Option B. Complex carbohydrates decrease inflammation and help decrease the risk of plaque buildup in the arteries. Option C. People with cardiovascular diseases should have a limit of less than 1.5 grams per day. Question 4. A 45-year-old patient in the intensive care unit, who was recently involved in a severe car accident, has multiple fractures and internal injuries. The patient has a history of chronic back pain and has been on long-term opioid therapy. The patient is currently on a pump set to deliver a basal rate of 10 milliliters per hour of morphine plus PRN doses for breakthrough pain. The nurse also notes that the patient has been frequently pressing the PRN button for additional relief. Given this scenario, which observation indicates that the pump may not be functioning correctly? A. The client complains of discomfort at the IV insertion site and has slight redness around the area. B. The client states, "I just can't get relief from my pain, even after pressing the PRN button multiple times." C. The level of the drug is 100 ml at 8 a.m. and is 80 ml at noon, despite the patient's frequent requests for PRN doses. D. The level of the drug is 100 ml at 8 a.m. and is 50 ml at noon. E. The patient's respiratory rate has decreased to 8 breaths per minute. F. The patient's blood pressure has dropped significantly since the last reading. Correct answer: C. The level of the drug is 100 ml at 8 a.m. and is 80 ml at noon. The pump is set to deliver a basal rate of 10 ml per hour. From 8 a.m. to noon, which is 4 hours, the pump should have delivered 40 ml, 10 ml times 4 hours. If the level of the drug was 100 ml at 8 a.m., it should be 60 ml at noon, 100 ml, 40 ml. The fact that it's 80 ml at noon indicates that only 20 ml has been delivered over 4 hours, suggesting the pump may not be functioning correctly, especially given the patient's frequent requests for PRN doses. Question 5. During a community meeting on health promotion in a small town with a significant elderly population, the nurse is approached by a group of senior citizens. They express concerns about their chronic back pain and have heard about alternative treatments. One of them asks about the effectiveness of chiropractic treatments for their age group and associated ailments. Considering the demographic and the context in responding, what should be the focus of the nurse's answer? A. Electrical energy fields and their role in pain management. B. Spinal column manipulation and its potential benefits for chronic back pain. C. Mind-body balance and its holistic approach to health. D. Exercise of joints and its importance in maintaining mobility. E. Acupuncture and its role in pain relief. F. The importance of regular medical checkups alongside alternative treatments. Correct answer: B. Spinal column manipulation. Chiropractic care primarily focuses on the diagnosis and treatment of mechanical disorders of the musculoskeletal system, especially the spine. Spinal column manipulation is a central component of chiropractic treatments. Given the context of the question, where elderly individuals are specifically inquiring about chronic back pain, the nurse should focus on explaining the potential benefits and considerations of spinal column manipulation for their specific ailments. Question 6. A 55-year-old client, who is a renowned pianist, is admitted to the neurology unit after a right-sided cerebrovascular accident, CVA, following a high-pressure concert performance. The client's family is anxious about the potential implications on his career. The nurse is performing a neurological assessment while considering the client's profession and the family's concerns. Amidst the assessment, which findings should prompt the nurse to take immediate action and possibly escalate care? A. Decrease in the level of consciousness. B. Loss of bladder control. C. Altered sensation to stimuli, especially in the fingers. D. Emotional lability, with episodes of sudden crying. E. Difficulty in coordinating finger movements. F. Complaints of a persistent headache. Correct answer: A. Decrease in the level of consciousness. A decrease in the level of consciousness is a critical sign that indicates potential deterioration in a client's neurological status, especially after a cerebrovascular accident, a CVA. It can suggest increasing intracranial pressure, further brain injury, or other serious complications. Immediate action and escalation of care are essential when there's a decline in consciousness to prevent further complications and potentially life-threatening situations. Question 7. A 6-year-old child, who has recently moved to a high-altitude region with his family, has been diagnosed with cystic fibrosis. The parents bring him to a pediatric clinic for an initial assessment and are concerned about how the altitude might impact his condition. They also mention that he has been more active and playing outside with new friends. Considering the early stage of this disease and the child's recent environmental changes, which later stage symptom associated with cystic fibrosis would the nurse not expect to observe at this time? A. Positive sweat test. B. Bulky greasy stools. C. Moist, productive cough. D. Meconium ileus. E. Clubbing of the fingers and toes. F. Shortness of breath after mild activity. Correct answer, C. Moist, productive cough. Cystic fibrosis is a progressive genetic disorder that affects the respiratory and digestive systems. A moist, productive cough is a symptom that typically develops in the later stages of the disease as the lungs become more affected by thick mucus secretions. In the early stages of cystic fibrosis, symptoms like a positive sweat test, bulky greasy stools, and meconium ileus in newborns are more common. While clubbing of the fingers and toes and shortness of breath can also be seen in later stages, the moist, productive cough is a hallmark later stage symptom that would not be expected in a 6-year-old with a recent diagnosis. Respiratory failure is the most dangerous complication of cystic fibrosis. Question 8. During a home health visit in a remote mountainous area with limited cell reception, a nurse arrives at a cabin to find a male client lethargic and confused. His wife, who seems visibly distressed, mentions that he fell down the stairs approximately 2 hours ago while they were preparing for a storm. She adds that he seemed fine immediately afterward and didn't want to worry their children, who are playing in the adjacent room. Given the circumstances, what actions should the nurse prioritize? Select all that apply. A. Place a call to the client's healthcare provider for instructions, even if it means driving to a location with better reception. B. Arrange for immediate transport or send him to the nearest emergency room for evaluation. C. Reassure the client's wife that the symptoms are likely to be transient and will resolve soon. D. Instruct the client's wife to monitor his condition and to call the doctor if symptoms worsen, providing her with emergency numbers. E. Assess for other signs of head trauma like pupil dilation, irregular breathing, or fluid drainage from ears or nose. F. Keep the client in a calm and quiet environment, away from the children, to reduce stimulation. G. Check the home environment for potential hazards that could lead to further injury. Correct answers A, B, E, and F. Following a fall, especially with a delayed presentation of symptoms like lethargy and confusion, there's a concern for a potential traumatic brain injury or intracranial bleeding. Immediate medical evaluation is crucial. The nurse should contact the healthcare provider for guidance and prioritize sending the client to the emergency room. Assessing for other signs of head trauma can provide valuable information about the client's condition. Given the scenario, keeping the client calm and reducing stimulation is also essential. Question 9. A 72-year-old client with a history of recurrent urinary tract infections and recent complaints of flank pain is scheduled for KUB, kidney, ureter, bladder, radiography in an outpatient setting. The client is anxious and mentions reading various preparation methods online. Given the client's age, history, and concerns, which of the following actions should the nurse take to adequately prepare the client for the test? Select all that apply. A. Instruct the client that they must be NPO for 6 hours before the examination. B. Administer an enema the evening before the examination to ensure clear imaging. C. Administer furosemide 20 mg IV half an hour before the examination to enhance visualization. D. Reassure the client and inform them that no special preparation is needed for this examination. E. Ask the client to drink fluids and empty the bladder just prior to the examination to ensure a clear view. F. Check for any allergies to contrast, even though it's not typically used in a standard KUB. G. Advise the client to wear loose-fitting clothing without any metal objects for the examination. Correct answers, D and E. A KUB radiography is a diagnostic imaging test that provides a view of the kidneys, ureters, and bladder. Typically, no special preparation is needed for this examination. However, asking the client to drink fluids and then empty the bladder just before the test can help ensure a clear view of the urinary structures. The other options, such as being NPO, administering an enema, or giving furosemide, are not standard preparations for a KUB. Question 10. The nurse is giving discharge teaching to a 45-year-old client, a professional athlete, 7 days post-myocardial infarction. The client, anxious about returning to his normal life and activities, asks the nurse why he must wait 6 weeks before having sexual intercourse. He also inquires about the impact on his athletic performance. Given his profession and concerns, what is the best response by the nurse to this question? A. You need to regain your strength before attempting such exertion, especially considering your profession. B. When you can climb 2 flights of stairs without problems or feeling short of breath, it is generally safe to engage in activities like sex. C. Have a glass of wine to relax you, then you can try to have sex. D. Your heart needs time to heal, and premature exertion can risk another cardiac event. E. You should consider discussing this with your cardiologist, who can provide guidelines tailored to your athletic needs. Correct answer, B. When you can climb 2 flights of stairs without problems, it is generally safe. After a myocardial infarction, it's essential for the heart to heal and for the patient to gradually return to physical activities. The ability to climb 2 flights of stairs without experiencing symptoms is often used as a general benchmark to gauge a person's cardiovascular fitness and readiness to engage in activities that require exertion, such as sexual intercourse. Given the client's profession as an athlete, this benchmark is particularly relevant. The other options either provide incomplete advice or are not directly related to the client's primary concern. Good luck, students, and thank you so much for watching, and don't forget to like and subscribe for more videos.